what are some of the more common cases you get with kids and adults that's coming in with allergies?
So, well, then let's start off by saying, like, what is the world of allergy and immunology? I find that it is when I throw the I word, everybody's like, wait, what does this mean? But if I say I'm an allergist, people are like, oh, okay. But if I say I'm an allergist immunologist, then people are just like, wait. So I think a lot of people, of course, are more used to the term allergy. But then when you jump and when the immunology gets into it, they're just like, So I'll start with what immunology is and then jump from that. So allergy and immunology kind of are very intertwined, which is why there are one specialty and like together. But the system, your immune system is really the system that fights infection. And so when that is not doing its job, whether it's overdoing what it's supposed to do or deficient, you see someone like me. So, for example, if you're immune deficient, that would be someone who is, immune system fights infection. So if you're immune deficient, you would see me in order for me to try to figure out which part of your immune system is deficient, which part has petered out, why, that type of thing. So people who get recurrent infections would see me. People who, on the flip side, a lot of times people who have undergone chemo, what happens with chemotherapy is that it attacks obviously the bad cells, but in general, a lot of cells that are helpful, including your immune system. So one of the common things that happen with chemotherapy is that your immune system decreases. Or there's a lot of other therapies that just kind of are, they decrease your immune system, which then can lead you to be such decrease that you're immune deficient. And then you would see someone like me kind of in conjunction to whatever other treatment you're getting. And then on the plus side or the other side, anytime people's systems kind of do their own thing, sometimes it can cause issues. Like I see a condition called angioedema, AKA it's a fancy way of saying swelling, but not just any type of swelling. It's like a deep swelling. A lot of times those people would just have sometimes you'll have unexplained episodes of lip swelling, unexplained episode of facial swelling, unexplained episodes of tongue swelling. I'd see those. Sometimes people get hives. Those are all your body just doing its own thing. They decided this is where I'm at today. This is the mood I'm in. So I am going to be swelling today. And then you would see someone like me to get both guidance and management of that particular thing. So that's the immune side. The allergy side, obviously a little bit more self-explanatory. So within the realm of allergy, you can be allergic to a myriad of things, from food allergy to drug allergy to seasonal allergies or environmental allergies, that type of thing. So I see all of that. So usually if there's a suspicion of an allergy by your primary care doctor, they send you to me to further evaluate that. So that is what I do on a day-to-day basis. In addition to that, commonly or frequently, I should say, I see asthma. Asthma is one of those. So a lot of times people's allergy practices would be like allergy and asthma and associates, or allergy and immunology and, allergy, immunology and asthma, or allergy immunology associates, which includes asthma. But asthma is a very, very common thing that I see, as is eczema. Because contrary to popular belief, asthma can definitely be triggered or associated with your seasonal allergies. Because some people are like, I'm fine. But if it's spring, I wheeze a lot. What's that about?
Yeah.
It's like, hi there, your friendly neighborhood allergist here. Looks like you need to talk to me. So that would be, in general, the nuts and bolts of what I do.